Hello and welcome to the webinar on the simulation, AI application, and real-world implementation of a COVID-19 mass vaccination drive-through. My name is Arash Mahdavi and I'm your host today. Today, as our guest presenter, we are thrilled to have Professor Ali Asgary, an associate professor and founding member of York University's Disaster and Emergency Management program. Dr. Asgary's teaching and research interests are in diverse areas of disaster and emergency management, with a special focus on disaster and emergency simulation and modeling, and community, organizational, and businesses' resilience and post-disaster recovery. He is currently involved as the principal investigator and co-investigator of a number of major research projects related to COVID-19 funded by multiple Canadian funding agencies. In this webinar, Dr. Asgary will talk about the challenges and options available for managing mass COVID-19 vaccination. He will showcase his development of a simulation of a mass COVID-19 vaccination drive-through, including its incorporation of an AI model. He then speaks to how it was turned into an online application and how it was used in some real-world mass vaccination sites. As I mentioned, I'll come back at the end to answer your questions with Dr. Asgary in the live Q&A section. Without further ado, let's start the webinar.
Thank you very much, Arash. Thanks also to AnyLogic entire team for organizing this webinar. It's my great pleasure and honor to be with you today to talk about one of the simulations that we have been working on during the past few months related to COVID-19. As Arash mentioned, my name is Ali Asgary. I'm from York University Disaster and Emergency Management program. And I am also involved in our initiative called Advanced Disaster Emergency and Rapid Response Simulation. ADRSIM is an initiative at York University focusing on disaster and emergency simulations using different technologies and methodologies. One of our prime software tools that we use in ADRSIM is AnyLogic. We have used AnyLogic in the past few years, basically to do some research around different types of disasters and disaster and emergency management functions. But most recently, as many of you have also been involved in disaster and emergency related to COVID-19, we have done also some works related to this particular situation. Our focus has been mainly on specific settings, disease transmission, COVID transmission in different settings, including hospital settings, particularly some specific elements of hospitals like surgery departments, ICU, dialysis. We have done some work on school-related COVID-19, especially school testing. We have done some works around long-term care facilities, simulating disease transmission and protection measures in those situations. And of course, one area of our focus has been on mass vaccination, for which we have developed a number of simulations of drive-through as well as walk-in clinics. Today, I will be focusing mostly on our story, a research story around how we started thinking about drive-through mass vaccination simulation and where we are at this point in this case. I would like to also briefly mention about our team and also funding agencies, including CIHR, Public Health Agency of Canada, Ontario Research Fund, and of course, ADRSIM, where we are based at. For today, I'm going to briefly provide you with some background about mass vaccination of COVID as it relates to different options, including drive-through as one option among different mass vaccination options. And then focusing on some of the technical elements of the simulations that we developed over the past few months, and show you some ideas about what we have worked on to build these simulations, turning one of our simulations into an artificial intelligence model and application. And also, I'm going to end this presentation with some of the real-world implementation of our simulation that we have been involved in terms of research activities. Needless to say, COVID-19 has created a lot of challenges and issues from many different angles and aspects. Vaccination, as it becomes available, has been or is becoming one of our most recent challenges and issues, which by itself has a lot of different elements, of course, from funding to communication of vaccination to general public, rules and regulations surrounding it in terms of approval and other things. Lots of equity issues related to vaccine distributions, and so on. And of course, issues related to cost and coverage of vaccine to within a community, within a country, and also globally. Within this framework, obviously, supply and logistics has become an important discussion and challenge for communities that have vaccine available to them and now want to distribute and vaccinate the public or those who are listed as recipients of vaccine. And that is our focus. Basically, our model and simulations try to help with the management, planning, and operation of mass vaccinations that are helping to plan better for supply and logistics of this operation. Now, when it comes to vaccination, I'm sure many of you know already that there are a lot of options in front of us. There's no one option that can fit everyone in every community. So we need to set up basically and use many different options that are available. We may use traditional approaches that include, for example, existing health facilities to vaccinate potential recipients of vaccines, or use some of the existing facilities that are not meant to be for vaccination, but can be turned into vaccination facilities. For example, community centers, schools, workplaces, etc. But there are also possibilities, especially in this case, for creating temporary mass vaccination clinics using larger spaces that enables us to provide this vaccination to large number of people in a shorter possible time with all the advantages that this mass vaccination process may have. There are obviously possibilities for using some of the existing care providers, such as pharmacies, etc. A combination of all these may be needed for different communities depending on their situation. But drive-through is just one option among this set of options that are available. Drive-through has been used in the past. It's not really new. Even in health service, it has been used quite often. Within the context of COVID-19 pandemic, drive-through has been used as, especially has been used for testing, mass testing. It has been also used for other health services or provision of other health services in different communities where health services are provided to potential users using the drive-through. In the past, we have cases of using drive-through for mass vaccination, especially during the H1N1. Some countries, some communities use this to provide vaccination, but this has not been as widespread as we are going to have in this current pandemic. So if you look at the news, you will see all around globally, basically, attention to using drive-through as an option, and good option, in fact, for mass vaccination. Countries in Asia, in Europe, and in North and South America are all have started using different forms of drive-through for mass vaccination. And advantages of this is becoming clear, more clear as more of these are becoming set up. There are obviously advantages in using drive-through over other options, but again, this would help us to better understand why we also focus on drive-through in this kind of simulations. It helps reducing the transmission because of course, as you know, lower number of direct contacts between patients, which is what we desire under this current pandemic. It also has low exposure because it's done in open space overall. It also reduces contamination of existing health facilities because they are used for most of them for current patients, and it's better not to overwhelm them with what they are doing. So using additional new spaces would be always helpful in this situation. And it also can help us to manage and vaccinate a large number of people compared to other smaller scale facilities. It's also mentioned that this is more comfortable for users, especially those who cannot move or have mobility issues. It's also accessible to those who are supposed to be self-isolated but need to be vaccinated. It's also good for places where they don't have facilities to do this vaccination type, but they can set up, temporary 1 or 2 days or some days of drive-through and get people to come to these places and get vaccinated. Of course, for those who have access to cars or can be provided with. It's also kind of easier to implement because it is an open space. You design it based on what needs to be done. And also it is applicable to places with no available existing facilities that I mentioned before. There are obviously some issues with drive-throughs that need to be considered in advance, especially with regard to weather conditions. Especially hot weather, cold weather, windy, rainy, etc., can impact the operations, especially if it is on open space. Over the time, solutions are becoming available to handle different kind of weather and climate, but still this should be considered as a limitation and problem. It also needs significant pre-planning and logistical preparation. It's available only when you have suitable space, or can be used when you have suitable spaces, basically. If you don't, that is going to be a problem. It also mentions one of the disadvantage of is that you need to provide lots of support for people coming with their cars, making sure that they are provided with urgent care if needed. There are lots of traffic related issues that need to be considered, especially backups inside and outside the drive-through. There are communication issues while people are in their car and you want to transmit information to them as to what the situation is. And there are also evidence or suggestions of possibility of exposure of staff to carbon monoxide, for example. This has been, there are lots of different research around this. Some say there are, some say there are not significant impacts, but something to consider, especially if you're planning large drive-through in small space. There are also accessibility issues that we also believe in. This is not one solution that can work for the entire community. This is only one option that help reduce the burden on other kind of facilities for vaccination. Those who can use this, better to use this so that it facilitate and expedite the whole process. Now, when it comes to drive-through, of course, there are lots of considerations. I already touched on some of them, but it is good to look at some others in details. And these are also basis for our simulation in this case. We have followed and tried to use existing best practices and protocols related to drive-through overall facility management. You need to have a site that you want to set your drive-through in. This could be and best to be near or close to freeways, highways, and large arterial ways or roads. It's good to be in a large parking lot or toll booths if it is available and accessible. Could be large sport facilities or fairgrounds. There are also space requirements. Once you select your site, you need to make sure that this has enough space for lots of different elements of your drive-through. That includes, for example, your lanes and stations and command posts, rest areas for staff, logistics, and vaccination supply storage, IT in particular, and administration related to that, safety and security, etc. So lots of space, and you need to divide and make sure that you have enough space for each of these elements. And space ownership is important too, because you need to make sure that this space is providing you with what you need, and also can be used over a significant period of time, or at least on your own, or the time that you need it. Often it is said public is preferred, but it all really depends on what is available, and even sometimes private spaces, if you have control over them, could be as useful as public spaces. There are some design considerations that we need to consider when working on drive-through options. In terms of number of lanes, number of stations in each lane, as well as different spots that you consider for the whole process. This is often, in case of drive-through for mass vaccination, includes, for example, spots related to screening, registration, vaccination, and recovery or observation area. That you need to make sure that your drive-through provides enough space and operational details for each of these activities, basically, for your mass vaccination using drive-through. There are obviously human resource management that needs to be considered, as each of these segments need to be supported by staff that are qualified for this. This is not just vaccination; it's vaccination, registration, security, traffic management, etc. that need to be all coming together, working together to make it successful drive-through. And obviously safety and security, like any other operation, is important. In this case, even more important because of the nature of the operation, number of people that are involved, and the process that is basically large number of cars in one spot at a time. Now, we followed, as I said, some of these basic protocols to develop our drive-through simulation. In terms of layout, as you can see here, this is the layout we developed for our first model, first version of our model, that consists of an entrance that cars are coming to the drive-through. They are screened in at this point, and then they go into the site. Depending on whether they are screened okay or not, they can exit from this lane or come into the drive-through from here. In terms of where to put all these things, it all depends really, but there are some, of course, details that need to be considered. Now, after cars passing this screening area, they go into choose different lanes. And in our model, we have included options for drive-through with 1 lane up to 10 lanes. This could be expanded, but realistically, going beyond 10 lanes is going to be too or more difficult to manage, and also may not necessarily even help with the overall process unless you have really, really large space that can be used for all different elements. So we stayed with what may be possible maximum number of lanes that are operationally feasible in our simulation. Now, the cars going through this, their first stop here is the registration stop. Registration spots could be staffed by up to 4 people in this experiment or in this simulation. As you know, each car may have 1 or 2 or 3 or 5 passengers, and so depending on number of passengers in each car, the staffs here are involved. But it is up to the user to decide how many staffs are provided for each vaccination registration stuff. And then once each car and passengers are registered, they go into the vaccination area. Again, there are different spots for vaccination staff, and depending on number of people in the cars, you will see they will be vaccinated and then finish the vaccination process, and then they go to observation or recovery area, that is these parking lots here. They stay here for some minutes, depending on the protocols. When we developed this model, initially we had no idea or a good idea about what is going to be the best protocol for COVID-19 vaccination. The previous vaccination, had different timeframes for recovery and even, registration and vaccination. So it's very important at the time for us to set, a range of times for each of these processes here. But we did not have much clue about what is going to be the case for some exact, time for each of these. But we developed our simulation so that users at some point can choose or can put these values depending on what is the real suggested timeframes for this. Now, but we found that this parking lot, because of 15 minutes observation that are required for COVID-19 vaccination, are not sufficient. So we created another version of this model that accommodates more parking spots and based on the existing and protocols that are provided for COVID-19 vaccination. So we developed this version that is our version 2 of the simulation. Both these simulations are available on the cloud for AnyLogic Cloud for people to try and see them. Now, in terms of the technical details, obviously, in our simulation, we have a large number of agents related to the whole process. But of course, the key agent is car agent, and also what we created as what we call it service lane agent for each drive-through lane. We created a service lane. Basically, cars when coming into using AnyLogic traffic library, cars are coming into the system based on the rates that are given to the system. Could be a fixed rate or a flexible rate over a day period. And then go through the initial screening process. After that, they go into each lane. And once they go into each lane, we have this service lane agents that is used to create the process or manage the process from the registration part to vaccination and observation or recovery part. Each of these are time stamped so that we can measure time that it takes from a car entering the drive-through till when the car basically ends its service in drive-through. So in this part, which is our service lane agent, you will see that registration is taking place here. We measure the time when registration starts till registration ends. There is a delay that is taking care of the time that is needed for registration. And then cars move into vaccination area. Again, same, we measure time when cars enter the vaccination area till when they leave vaccination area. And this delay takes care of the vaccination service that is provided here. And once they finish, of course, with the vaccination, they go to the parking lot for a period of time that is now 15 minutes minimum and 30 minutes maximum for those who need extra attention. And they, of course, after that, they leave the vaccination area. So this is the most important part of the car agent process. We have created, of course, agents for staff and a super agent for all the staff supporting this process to take care of those, human resource elements of this. Also, this is not really the focus of this simulation. The focus of this simulation is to see how this operation works and how many cars can be processed through this and how many people, depending on number of people in each car, are going to be vaccinated using this service in a shift or a day or time period as indicated by the user. And obviously, depending on number of staff that you assign or choose for your drive-through, then you can have the total number of staff and other related information can be extracted based on that from the model. So basically, when you start using this model, we have some parameter setting that users can set for their model, for their experiment. Some of these are related to service times that we have some initial values put here, but you can change them, user can change them. These are all related to screening, registration, vaccination, observation, and others. Then we have also an element of setting parameters for duration of your drive-through in terms of whether you want to have it one shift in a day or 3 shifts in a day. You set those here. Also, we have an option for registration. Often it is said, and it is also experienced that is better if we can have some sort of arrangement or pre-arrangement for pre-registration. So we have inputted this so that it allows portion of the registration to be done online or whatever is best in each community. That would help, facilitating and expediting this whole drive-through process. And this has been the case in the past experiences. Those who have had pre-registration, they can really do much faster and get this operation done much more efficiently. And then we have some aspects of lane parameters where you can set how many lanes you want to have open, and also if you want to have your lanes for high occupancy vehicles. And also if you have an option, or you want to have an option, what we call it parallelized service, which allows you to provide registration or vaccination to more than one car at a time. By checking this, you can take that option and use that. And also we have options for changing the incoming cars into the system. It could be a fixed number per minutes or per hour, or it could be set to be varied over different times of the day. And once you set this, of course, you can run. I'm going to quickly run a sample of our simulation here so that you can have some idea about how it works. As you can see, again, this is the new version of our model. You can have it and view it in 3D as well. We have this provides a basic process inside. Of course, there are lots of programming behind that. This provides number and values of or output of the model. The outputs are mainly in terms of number of people vaccinated, number of cars in the system, as well as average waiting time for cars at any given time in the system, which is what most operations really need to know before go and move on to their planning and management of their facilities. Now, what we, of course, when we finished this simulation, we wrote an article on that. This has been published already, and this is accessible, open access paper. Already more than 4,800 downloads, full article downloads for this paper. That is quite significant, and we have received lots of requests and comments on this from different people interested in setting up this type of drive-through. I'm giving you some after results. Of course, these are not the AnyLogic results. These are the results that we extracted from AnyLogic and have done some work on them to present it for our publications. But overall, as you can see here in this sample graphs, the type of results that we can get from our simulation. The chart in your left shows cars in drive-through at any given time. This is for 1 day, for example, run, and also number of passengers in drive-through, depending on number of people in each car that can be ranged from or randomly distributed from 1 to 5 in this case. And then you also have the overall number of cars and passengers in the drive-through over your time period. So the totals are here. These are the numbers in any given time in the drive-through. This information can be also extracted in terms of number of cars in each lane. Depending on number of lanes that you have, you may want to see if they are, how different they are, how close they are. And then this helps you to make some adjustment to your lanes so that it helps optimizing your throughput, basically. And this is an example of average time in drive-through based on one of the runs that we have had or number of runs that we have had. This is an example output results that can help you also to see what would be the difference if we open, for example, just 4 lanes versus 7 lanes versus 10 lanes. Now, obviously, the more lanes you open, the more cars can be or people can be vaccinated, but obviously the more cars you have, the waiting time also increases. So this shows how adding more cars or lanes impacts your average time in drive-through, and this all depends on, of course, how you design and put together all different or set different elements of your drive-through. But this example tries to show that you have this simulation provides you with options of doing lots of scenario-based planning and arrangement to see what would be the impacts of different settings and different arrangement of your drive-through in your overall output. This is another example when you change the number of incoming cars into your drive-through and see how that impacts your overall results. again, in this chart, the left chart, you see cars in the drive-through in terms of different inputs or car arrivals, whether it's 5 or 10, you can see that difference. And again, depending on how many cars are in the drive-through, you can see different performance of your model. Now, once we develop this simulation, we came to the idea of using other elements of AnyLogic platform to create basically an artificial intelligence version of our simulation. This simulation by itself does not take too long to run. However, if you want to run it multiple times for, to make sure what the results are, meaning, for example, if you want to run one simulation to take care of the stochasticity of your model, you need to run it, for example, for 100 runs or so to get that result. That would take, of course, some time. To prevent that and also provide more options, this was our first use of AnyLogic Cloud to create this large sample data. So we wanted to really do this as a research process. So what we did, we took our simulation, we look at our parameters, and then decided to choose those parameters that are most important for our model and simulation, and select the possible maximum range for those parameters that are listed also in this. And then we run this model. We ran this model for, as you can see here, for around 130,000 or 38,000 runs using AnyLogic Cloud API, of course. It took like 1 week to go through this process and extracting the results of these multiple runs of our simulation. And then, of course, once we collected these values from our runs, created a large data set of this parameter and output values, using AnyLogic Cloud API, as I said, which allows you to basically run your simulation over the cloud in some sort of parallel simulation or distributed simulation. For that, we developed this AI model, basically using a 5-layer feed-forward neural network, as you can see here in this image below. Each layer consists of a fully connected tensor, and also we used ReLU activation function for our machine learning model. We used about 80% of our data for training and 20% for test. And running and using this model, we found that it provides really good model at the very end once use all this data, and thus we developed and generated the last and the best model that we could get for our AI application. We then deployed this application into a cloud service provider that enables people to run this application on their own, again, using or by providing the type of parameter values that they like, and get the results in like a matter of seconds after that. So they don't really need to run the simulation and wait for the results. This is the interface of our AI application. Again, this is available for you to try as well. The website address is provided here, www.addersim.org. So you set your parameters and choose the number of lanes you want to have in your drive-through, and then run the application. It provides you basically with results like this and more. You can also download the results and keep repeating the same scenario with maybe different parameter settings, and see what your drive-through outputs will be in terms of number of cars and passengers vaccinated. We have also published this as an article, this AI application as an article in open access. You can, again, if you are interested, you can take a look at this paper. It provides much more detail about this process for you. Now, in a few minutes that I have, I'm going to also talk a little bit about some of the experiments, research experiments that we have been involved in some of the real cases. The first case we were involved was a case that we were approached and we also were interested in doing some research on at University of Colorado in Denver. Basically, they wanted to set a drive-through, and we simulated that drive-through in the planning stage and also in post-planning stage. All the information about this drive-through, which was, to our understanding, one of the first drive-through for COVID vaccination in the US. This happened in end of January 30 and January 31st in Denver, Colorado. And during the 2 days, they were able to vaccinate about 10,000 people with about 834 cars per hour. For each car, it took 22.4 minutes to go through the process. And the documentation about this is available that you can also take a look. What we did, basically, before this has been implemented, we created a simulation of this drive-through to help with the planning process and see if our simulation actually can provide realistic information about both in terms of number of passengers that can be vaccinated and also average time. The simulation actually provided reasonable estimation of these values based on the information provided at the time of planning process, which helped actually making the go-ahead decision with this drive-through at the time, saying that yes, doing this is feasible, possible with what you have, the space that you have, and also the arrangement that you have. And once this simulation when this operation concluded, we then used also the values extracted from the real implementation in our model to see if our simulation can match the reality. And in fact, the results were really close. We have not published that, but we are about to submit an article about this experiment or real case research that we did with this particular real world experiment soon. For this, the whole process was very interesting because of the situation and evolving conditions in terms of weather and also in terms of number of people and kind of people being vaccinated. Initially, we developed this model, which was what the planners were thinking about. This simulation is based on a layout that has, of course, a screening before. This is a very large site. registration here, and with 6 lanes basically, and then each of these lanes end into 3 vaccination lanes. Vaccinations are here. Of course, these comes to 18 vaccination, but 2 of them were dedicated, one in this site, another in this site, for extra time needed for vaccination for those who had registration difficulty, etc. And after they finish here, they go to a large parking lot here for observation area. We did not do much, although we simulated the parking lot, but not necessarily the same layout that they had it in actual operation, simply because what was important for us was the number of spots available for parkings, not the way that the parkings are operated. Once this one was first experimented in, as I said, in January, then the idea came to, because of the weather condition, for subsequent operations, it's better if we combine registration and vaccination area together, so that people are all inside tents to prevent them from cold weather. And but instead of having 6 lanes, we want to have 8 lanes, combine registration and vaccination. This would save time maybe, and also save in terms of helps with comfort for staff that are providing the service. So again, cars are passing through, but in this case, we also allocated some additional spots here for in case there are problems in each of these cases for people who may not have registered previously, etc. We just want to send them to this spot so that it doesn't create backups for the lanes. Now, the 2 other simulation of this type we are doing, this has not been tested in reality yet, but for planning purposes mostly, is to see what would be the difference if we add 2 other lanes. That is, in this case, you have 10 lanes, the same process that we have here, but instead of 8 lanes, basically 10 lanes, and a combination of this and the first model, 10 lanes going to this. And this last version is when you have 8 lanes, but each lane goes into 3 vaccination spots, just to see how this functions in terms of the operation now that we go into better weather condition and situation. And also the people who are coming are not necessarily older adults. It could be families with different age groups. So this was one of those interesting real-world experiments. I'm just running quickly so that you can see how it looks like, this real simulation. This is the 2D for the vaccination and registration area. This provided a lot of good information about how to operate these kind of operations for COVID vaccination, and many other facilities are actually using this information to set up their own operation. This is the entrance area to the vaccination clinic. This is our simulation, but if you see the real videos of this, you can see how close they are really. And in terms of output, you can see the number of cars in different lanes, and also average time in terms of distribution, and also times that it takes for cars to pass through this process. And based on our simulation, it was a little bit more than what the reality says, not too far really. Anyways, this was one case that I wanted to show. The other case, that is a smaller case in Canada, we also did this experiment to see the performance of our model. This was a case where this is a high school, for a drive-through in a high school with this setting. And we also created a version of this for another location that is kind of airport currently used for drive-through. This experiment also is trying to, for us as a research, helps us to validate and see how our model functions. But for the users, it helps basically to arrange and see what they are planning can be implemented without real problems. One that we are currently working on, again as a research to check our model, is an ongoing design and planning for a drive-through in Chicago, United Center. That is in planning stage still, and we are just developing some different types of models to see how our simulation works under different types of layouts. This is going to be also an interesting application because of the difference in terms of where this is located, type of layout that we are working on. With this, I'm going to conclude, and basically concluding by this that AnyLogic software was a really interesting and important tool in being able to create a simulation of this type in terms of quite fast indeed, and also something that is very useful for overall planning and operation of these kind of facilities. As a research tool and also as an operational tool. From research perspective, obviously for us, this was a very good experiment because we not only developed this simulation that can be used in real world, but also simulation that enabled us to think about other possibilities of using this kind of simulation in generating, for example, artificial intelligence model. And one more conclusion that I really want to mention here is that at the very beginning, when we started this, we looked at what is going to happen in the future of this pandemic, and not trying to model based on the situation that existed at the time. So this helped us really to think what is going to happen next and what we can do now to help what is going to happen next. And so focusing on vaccination at the time when really vaccines were not even in production at the time, they were mostly at the initial research phase, seemed to be, unrealistic at the time. But over the time, by the time we finished the simulation, we did publish this. It became handy. Basically, when we finished the publication, it was the time where vaccines were coming for test trials and eventually for actual use. So this paper, for example, was published in November almost, and by December, the vaccines became available, and many communities started thinking about how to do these operations, and so they came to learn and know about drive-through and started using this. And so we are really happy that we were able to contribute to this process through this research and publication. And thank you for all of you for listening, and I wish you all the best. And if there are any questions, I would be happy to answer. Thank you very much.
Okay, thank you all for attending the webinar, and thank you for your attention. We have Dr. Asgary with us. The first question, I'm going to kind of add two questions together. The first part is, which AnyLogic libraries are used in your model? And I'm going to add this, which or what feature of AnyLogic has been used in this model that cannot be addressed with other simulation software or unique
I
to
got the
AnyLogic?
first part. Thank you. I got the first part of your question, which was about AnyLogic libraries. Basically, we use the common libraries that are used in any kind of model, but specifically we use as it is the case, traffic library, as well as pedestrian library and process library. These are the key among other libraries. I didn't get the second part of your question.
So the second was, what feature of AnyLogic has been used in this model that cannot be addressed with other simulation software?
Well, it is a combination, I would say. There are a lot of, combination, for example, from the visualization part that is very key. I believe being in disaster and emergency management field, that helps professionals not in the simulation to be able to visualize what is happening and what you are modeling, which to me is significant. Not only the 2D but also 3D model, especially when they see that their floor plan, for example, lays into an actual semi kind of live simulation, makes a lot of sense to them, and also quickly they can absorb what's going on. This is part, and of course, being able to program at the same time the way that you want the model to operate. It is a great tool. Not every simulation tool has this flexibility of being able to program it the way that you can make your model as close as possible to real world. These are stuff that you can talk a lot about.
Yeah, I personally like the fact that you used a cloud API, and I think that helped with analyzing the data or having a more efficient way of going through running all of 100,000 runs.
Absolutely. Yeah, that was a great support tool for this kind of, and we love to use it much more in the future.
Okay, fantastic. One other thing that I pretty much liked was when I saw your article in Bloomberg article. I saw a link to AnyLogic Cloud, and people can interactively see your model. So it definitely helps a lot when people, hearing about the simulation is one thing, but being able to experiencing firsthand, changing the parameters adds to the credibility of a solution, so people can easily figure out on their own that what different scenarios will result. So that's something that I personally liked a lot about the way you approach your model. So let me jump into the next one. How easy is it to customize these drive-through simulations for a specific location?
Very good question indeed. It is pretty much easy and quick if you know the basics of AnyLogic first, and second, if the structure of your drive-through is similar to the structure that laid out in the simulation. That would take not for a person familiar with AnyLogic, probably an hour or two just to reset the simulation into that structure. As I said, a structure has to be the same. For example, following the same lanes, not lanes necessarily, it's the same structure in terms of all those four elements, for example, registration, vaccination, and observation and screening. If you have the same structure, it is easy. Otherwise, still, it is not too complicated. We have done it customized it for those cases that I mentioned in the presentation. Not too long, but still, I would say that takes longer because you have to redo the model. But because you have the structure, it is the base model. It's not too complicated or time-consuming as well.
Okay, thank you so much. And Dr. Asgary, I guess you gained a lot of new fans. There are many people who are asking about how to get access to your work in regard with COVID-19. And I know that you mentioned some URLs that people can look at. And just before you give a better answer to this, I wanted to clarify that every any information that is it has some relationship to what Dr. Asgary has shown, and links to all the material will be sent to you in the follow-up material. But with that, is there a good way to get access to your body of work?
Well, I would say thank you very much, and thank you for the interest. We have, as usual, we have several places where we publish our work in terms of simulation. Most of the simulation that we make and are possible to publish it or release it online, we put them on AnyLogic Cloud for public in view. In terms of publication, obviously, we have done some publications around other topics as well. I think people can find them easily through searches, but our main place is York University ADERSIM Research Initiative. That is adersiminfo.yorku.ca. Yeah, that's I would say this, but we are also available in LinkedIn and Twitter and others.
Okay, fantastic. So I'm going to go to ask one more question, and it's kind of, there are a couple of questions that I paraphrased into one, and I know that you extensively talked about like how you approached using an ML model as as a proxy or an approximation of the simulation for post-processing. But is there anything else that you wanted to elaborate about why you chose that AI angle on your work, and what was the necessity for that? For more specifically, somebody asked what were the inputs and outputs to that AI model?
Very good question. Regarding your first part, we did basically this, first of all, as an experiment to see how, because we were interested really in developing simulation-based AI applications. This happened as we were trying to do these kind of simulations and AI application. This simulation was going on in our lab, and then we thought this might be a good candidate for doing this experiment. And also, as I said in the presentation, not only that experience was really helpful, but also for simulation like this, when people want to plan quickly and fast, even taking time for a few minutes to run one single model, it's too much time still. So we did this, and it was found to be really fast after we developed this machine learning tool. The model runs, for example, for a full run, even with high speed, it takes some minutes. But when you develop this AI application, it's seconds really. And with regard to the second part of your question, which was on
inputs and outputs.
Input and output. For the input, we had all these parameter values given to the simulation, and for the output, mostly we focused on number of cars and passengers, as well as average waiting time.
Okay, fantastic.
Did you?
Yes,
were you able to get my response?
It was, but we kind of heard it. So I make sure that we have a written answer in the follow-up material for that specific question. So is there any other thing that you want to address at the end before I get to the final remarks?
Not really. I just want to thank you and thank everyone participating in this session, and looking forward to help with anyone interested in these kind of activities. We are open to collaboration and research. And again, thank you for AnyLogic for setting and particularly you hosting this session. Thank you very much.
Thank you so much. And again, I want to thank you for accepting our invitation and spending all the time in the middle of your busy schedule to share your invaluable experience with the simulation modeling community. One last thing I wanted to mention is we all witnessed how impactful simulation could be during the COVID-19 pandemic, and AnyLogic company is very proud and humbled by the extent of our contribution to this scientific efforts in the battle against the pandemic, and we contribute majority of this to practitioners and experts, researchers like Dr. Asgary, who are utilizing this tool to build these fascinating models and help others. And by the way, at the end of your presentation, you showed a scenario in Chicago. Probably you're going to help me personally as well. So thank you so much for that. We are really appreciative of your work. So I think our time is done, up for today. Thank you again, everybody, for joining us. And thank you, Dr. Asgary, and have a great rest of your week. Thanks.